And as we've reported, state and local health officials have been preparing for this since the spring. Governor Ralph Northam said yesterday that once Virginia gets its first doses, distribution to healthcare workers and long-term care facilities will begin. 10 on your side's Tamara spoke with a nonprofit organization focused on helping older Americans.
Well, this is what they've been looking forward to. They know that this is not going to be an immediate change, but they hope that it's a step in the right direction.
It's the first real ray of hope that we've had since March.
With talk of the Pfizer vaccine on its way to Hampton Roads early this week, there's a lot of talk about who will be receiving the first doses. When we spoke with Riverside health leaders yesterday, they confirmed with us that frontline healthcare workers would be first on that list. Then that trickles down to others in the community. Melissa Andrews is CEO of Leading Age in the Commonwealth. She's advocating for the elder population to be high on that list as well.
We've been really pushing through our advocacy work to make sure that extends to assisted living, adult day, home health and home care workers, as well as independent living residents who are living in a communal setting, like those in a retirement community.
I asked why she believes this community should be high on the list.
Because we know how easily this is spread, and we know that staff is the main spreader because they go back out into their lives.
But because of the risk factor, receiving the vaccine may look different.
So in Virginia, CVS and Walgreens are the designated pharmacies that are working with providers to bring the vaccinations to their campuses. So they're working directly with their pharmacies, and based on the allotment that we had as a state, those pharmacies are delivering a certain amount of doses based on the requirements of those communities.
Absolutely.
She says every day she hears news that an establishment they work with has a change or an outbreak. So this focus is very important to her.
So their immunities is not necessarily as strong as, say, yours or mine. So that if we got COVID, it might knock you down for a couple of days, but it potentially will not be as life-threatening as if you are in your 80s or 90s. These are those who have built this country so that we can do and accomplish what we want to. And so they deserve the utmost respect and the quickest response since they're so vulnerable to this pandemic.
Now, Melissa tells me that there is still a long road ahead of them as the vaccine is distributed throughout the community, but she sees this as a light at the end of the tunnel. We'll keep you updated on air and online with any updates. But for now, Tamara, 10 on your side.